A family physician goes undercover to go through the program herself, and Dr. Maggie, you had no idea.
I had no idea. I don't know what the heck she's gonna say, but I would love, like, a physician who came through with, just to experience it, and then your unique feedback to other patients out there, because you came in as a patient, but you also have the backgrounds of physicians. So I'm really excited to hear from you.
My name is Elisa Nance, and I am 53 years old, and I was a family physician for 20 years, but became disabled in 2017. I'm a mom of two sons who have autoimmunity. Both they have Crohn's disease and neurologic disorders related to autoimmunity. I was actually diagnosed with Crohn's, Hashimoto's, and dysautonomia with encephalitis, and that's what took me out of practice.
And you've been dealing with this for decades.
Yes, I started having symptoms 30 years ago.
Okay.
3-0. Wow.
When I saw the videos and you weren't just saying, "Okay, you're in menopause because you have these 5 symptoms. Here are these 2 medications that are most likely used." Actually look at the data and customize it to the pattern that you see. First of all, we
Individual.
didn't learn the patterns in med school. We don't
Yeah.
even I've never even heard of the patterns. And you customize it to the patient so that they have an impact that's fully built to breed success.
I actually teach people like you, not just physicians, everybody that go through the program, how to do this themselves. I mean, I think that's
That's
the key. Like, first of all, find a doctor that knows this stuff, and then find a doctor who wants to teach you that stuff so you know how to do it and you're not dependent on them. But then some people are gonna be like, "Is this too hard for me?
Uh-huh.
Is this too hard for someone to be able to understand and learn this?" Because I call this mastery.
Mhm.
I teach mastery level of understanding of what's root causes of any chronic disease. So, is this too hard for anybody? And I would love to hear what you witnessed in the people that you went through the program with and what your experience of that with their learning process.
um, I think that you are brilliant in performing the videos that you can review, and you start kind of very simple with the concept in each pillar, then you build on it, and then you build on it, and then you have like a mastery questions, and if you didn't get it, you can go back and review the videos, and then you move to the next pillar. But I think the biggest thing is when you get on the live streams with other people
Yeah.
and you're modeling for each other, you become each other's teacher. And I think that it's just brilliant how the reinforcement constantly does help you succeed and become a master, or have mastery of the concepts. It's very good, very well done.
And as somebody who has gone through medical school, I'm just curious to hear you actually rate the quality of this education.
It is top notch. It is stuff that you can't go learn somewhere without spending thousands of dollars and many years of experience to be able to portray this information to people. And I don't think it's too hard. If you know nothing about nothing, you can learn and be successful. And it may take you a little bit more time if all the verbiage and the definitions of things are new, but you can master it in the time frame that she allows. And thank goodness she gives you the full 10 weeks to become a master at it. And then you get her one on one. I tell you, I told all my friends I get like 5 hours a week with either Dr. Maggie or a nutritionist or a psychologist or physical therapy work. And it's just amazing that you have all of it in one location where normally you'd be paying multiple copays multiple times. In one of your introductory videos, you said, I don't think I could get people well because it took 5 years of one copay every 3 months to do the program in 10 weeks.
But think about it, you had to deal with autoimmune disease for 30 years. It's not even 5 years. Like, I think about
No.
that. The price of having an autoimmune disease, like in your case, 30 plus years, in my case, 23 years or so, but probably longer. Like, when I think about the cost that I had put in there to even not be better, that's the problem. It's not, you could pay all those copays, you could pay for all those meds and all that and put all that time in there. I didn't learn any of the things that I'm teaching now through that process. everything that I learned now, I had to do it independently on my own against the grain, against what everybody was telling me. They told me this wasn't going to work. They told me I was crazy. They told me this wasn't going to work. They told me to just be on an antidepressant. And against all of that, I said, no, I need to survive and thrive. And then once I learned, I mean, this is blood, sweat, and tears of learning for me. It's over 16 years of education I've invested, time I've invested, but I love to teach it. So I think, Elisa, that what you're talking about is that I love to teach and I love to make really hard concepts really simple, but not necessarily easy. Simple, but not easy, right? So that I think anybody who has the desire and the commitment to want to learn and master it can do it.
The other thing that I think is just amazing and really made me do it was your vulnerability
Mhm.
of how you talked about going through these trials yourself,
Mhm.
sort of out of desperation, you went to additional learning.
Yeah.
And then you talk a lot about your relationship with your mom and
Yeah.
how your mindset played a role in things. And I'll tell you, when I practiced, one of the biggest criticism I had from my peers is that I was too nice, too close, too vulnerable. And
Mm.
what I found is my patient said, "But that's what makes you such a good doctor, is that you open your heart and you share your own experience because you're real. You become as a peer, but still with the knowledge, and people believe you because your experience teaches more often than what you can tell people from a book. It's unbelievable because most of the time people in the medical community are really isolate and kind of keep a barrier between the
Mhm.
physician and the patient. And sometimes those boundaries are necessary because it could get out of hand and so forth, but you do enough that makes it real to people and they're drawn to you because of how you share your personal experience.
You know, it's interesting because the first year when I started this program, Lisa, I didn't share my story. I didn't share my story for exactly those kinds of reasons. Part of it was just people don't want to hear all the shit you went through. Like as a thought I had. People don't want to know, and maybe you don't want to share all of that. But it was interesting how some people who've been here for more than 6 years will probably remember that maybe the first year that we had the Facebook group, I had my videos. It was very much like a lot of times I was like trying to teach and give a lot of information, but I wasn't being open and vulnerable because that's scary. That's scary. And about a year into it, I just kind of made a decision. I was like, you know what? I'm just gonna be the real me, warts and all. And if people don't like me, they don't like me, whatever. But I just can't continue to be this person. I'm just gonna be honest. And so I started telling my story, and parts of it didn't make me look good. Did not make me look good. I've done videos about what my biggest shame was as a physician. I'm curious about this for you. Now that I know what I know, my biggest shame as a physician is dismissing all those women that were me.
Mm. I have lived that experience, but I think the nature of me is that I accumulated a lot of people like me, and I said, "I don't know that I can help you, but I will stick right beside you and help your symptoms the best I can." But I think my biggest shame is that I sort of fell into the trap of the hamster wheel. I was a hamster on a wheel and I get off to eat barely. So my blood sugar was probably very bad. Then I get back on and then I jump off just to go to the bathroom. And I didn't necessarily rush people through because I could change my schedule to extend some time, but it never was enough time. It never was enough time for mastery or to hold people accountable.
Yeah.
And that's why I really love this program because you actually have the time, give the time, reinforce people's experience. When they don't do well, you put them back in track. When they're great, you praise them. And this is a model of education. And you're truly an educator, probably more so than a doctor.
It's not easy, but it's simple,
Yes. Yeah, you
right?
really did that and a great job. And then constantly adding all of the bonus content too. As
Mhm.
you go and you're having discussions in the mastermind calls or on these discussions, you'll add that information in
Oh,
there. And
yeah.
it's so valuable because maybe
Yeah.
it's something you can go in there and then search in Transform University about a topic.
Anybody wants to learn more, there's a link above this video, and there's gonna be a link we'll put in the comment section for you to just start a chat with our team. Thanks, everybody.